Thank you very much, Emily. Good morning, everybody. It's really exciting to see such a full room this morning. I've had the privilege of giving these kind of opening remarks before, but I've always given them on behalf of our director, Linda Birnbaum. But this is our first workshop since the retirement into a very active state. Is Linda in the room even today? No, okay, but I know she has a strong interest in this topic and in this committee. But the first time that I'm not representing Dr. Birnbaum, but actually here to represent Dr. Rick Wojcik, who's our interim director and is very sorry not to be here today. This is a topic of great interest. And also our interim deputy director, Gwen Coleman, who would also be here if that were possible. But it's very exciting to be able to greet you on behalf of NIHS. For those of you who are not familiar with NIHS, we are an environmental health part of the NIH, one of the 27 institutes and centers of the NIH, but real different in a lot of ways. The first way is that we're not located in Maryland. Our main institution is located in Research Triangle Park, North Carolina. There's a picture of our beautiful campus. We have a very small office here on the main NIH campus in Bethesda, represented by Dr. Aubrey Miller, our Chief Medical Officer, myself, Chris Weiss, who also is interested in this topic, and our other staff. But most of us are down in North Carolina. We have some parts like other institutes and centers, so we have a robust intramural laboratory down in North Carolina. We are a grant-making institution like NIH, but we also have some fairly unique parts that are very relevant to the topic today. One is that we house the National Toxicology Program, which is a collaboration between the Food and Drug Administration, the National Institute of Occupational Safety and Health, and our institute, which takes on kind of complicated regulatory and emerging toxicological topics and has taken this topic of microplastics on, as we will hear later today. We also have a Superfund research program, which goes beyond the basic investigation of mechanisms and epidemiological associations to try to get to the solutions side and the risk assessment side of problems, and that's a unique asset on a topic like this. We also have a very unique worker training program, which has been involved in training workers to protect themselves in cleanup situations, also of relevance to this topic. We're also unique among the institutes and centers of NIH in having a very strong public health and prevention focus, more so than the development and discovery of new treatments, vaccines, and diagnostic tools. So that's our institute. We have an operative and very broad strategic plan that this topic fits squarely in. We divide our strategic plan into three main types of activities, again, denoting our little bit of a difference from the other institutes and centers. We have a very strong discovery and advancing science, but we also look into promoting that translation into action, and for us, that's public health action. And our third area is the kind of leadership and stewardship function that we serve both domestically and internationally. And the topic of microplastics is clearly a very important emerging environmental health topic that fits squarely within our strategic plan. That said, it's also really new to us, and NIHS is just starting to engage on this topic. Importantly, we've been involved along with the FDA, and we'll hear more about this shortly, in strong consideration of the health risks of microplastics under a subgroup of something called the Nanotechnology, Environmental, and Health Implications Group, which is under the White House looking at, it was set up about 10 years ago, my old stomping grounds, to look at the health implications of nanotechnology development. And since microplastics are sometimes nanoplastics, it has fallen into that group to try to work on that, and we're supporting that as an institute. Our National Toxicology Program, again, this collaboration, NIHS, FDA, and NIHS, has taken up some characterization work in the same way that we've been doing this for nanoparticles, and we'll hear more about that again from Dr. Neil Patry, who's here, and Nigel Walker, who will be here if he's not already. We've provided support for conferences on this topic, and our most recent Oceans and Human Health grant-making effort gave one grant to the University of South Carolina at Columbia, and it's explicitly within their aims to start looking and characterizing the toxicology of microplastics. So, as Keegan mentioned, this is the 27th meeting of the Standing Committee, and she said that we were a horizon scanning, and so I thought I'd put up a slightly different horizon. This committee, we have, in addition to the milestone of Dr. Birnbaum's retirement, we actually passed a milestone with the committee that we're quite proud of as the lead sponsor of 10 years of the existence of the Standing Committee. This is, that happened last summer. So I wanted to acknowledge it with a slightly different look at the horizon. The horizon of this committee really, as Keegan said, spans the gamut from a very macro scale to the very micro scale, and of course microplastics are kind of both, right? We're talking about nanoplastics inside people's body, in addition to the huge waste problem that we have on a very macro scale on this planet. So I thought I'd give it a little bit more of an epic kind of, and I'm very happy to share this slide with you as well. These are all hyperlinked. But we're very proud of the 10 years, very proud of these 26, and very proud of this decade to celebrate of emerging science to protect life on a fragile planet. So with that, I'll close. And thank you for the attention. Very excited for the rest of the workshop. And I think I hand it over now to Kevin Elliott, who will tell us more about the workshop.